Ever wondered about the health risks that could come with getting a tattoo? Yes, you heard that right. Tattoos, while being a popular form of self-expression, also come with their share of potential health risks. Let's start with the basics. When you get a tattoo, you're essentially inviting a needle to puncture your skin several thousand times a minute. This process opens the door for potential infections, allergic reactions, and even skin disorders. In fact, certain dyes used in tattoos could trigger allergic skin reactions, causing an itchy rash at the tattoo site. But let's delve deeper and talk about a more serious risk associated with tattoos, the Hepatitis C Virus, or HCV. HCV is an RNA virus that primarily spreads through blood-to-blood contact. Now you might be thinking, but I'm not sharing needles or anything, so I should be safe, right? Well, not exactly. You see, HCV transmission is not limited to injection drug use. It's also associated with other factors like blood transfusion received before 1992, intranasal cocaine use, and yes, tattoos. Research indicates that the prevalence of HCV is higher among those who have tattoos. This could be due to the use of non-sterile equipment or contaminated ink. Remember, a single lapse in hygiene during the tattooing process can put you at risk. And while sexual transmission of HCV is less efficient, it's still a possibility, making safe sex practices essential. Moreover, the risk doesn't end there. Other blood-borne and sexually transmitted infections can also be contracted through tattooing. For instance, the HIV virus can be transmitted through shared needles, which includes those used for tattoos. The point is, getting a tattoo is not a risk-free endeavor. It's a decision that should be made with a full understanding of the potential health risks involved. Always ensure that your tattoo artist follows all necessary safety measures like using sterile equipment and fresh ink. Let's be clear, we're not saying don't express yourself through tattoos. We're saying be informed, be cautious, and always prioritize your health. So tattoos can pose a significant health risk, particularly in relation to hepatitis C. Make sure you weigh these risks before deciding to get inked. After all, your health is your wealth. But did you know that tattoos can also increase the risk of HIV infection? Tattooing involves the use of needles to insert ink into the skin. With each puncture, the needle creates a small wound. Now, if that needle isn't clean or sterile, it can introduce harmful pathogens into the body, including the human immunodeficiency virus, or HIV. HIV is a blood-borne virus, which means it is primarily transmitted through the blood. In the context of tattooing, if a needle is used on a person with HIV and then reused on another person without proper sterilization, there is a risk of transmitting the virus. While the chances might be slim, they are not zero. And with HIV, it's a risk no one should be willing to take. This is why it's crucial to ensure that the tattoo parlor you choose adheres to strict hygiene standards. This includes using new single-use needles for every customer and sterilizing all equipment before use. Now let's talk about adolescents. Adolescence is a time of exploration and risk-taking, and for some, this includes getting tattoos. However, it's a group that's seen a concerning rise in HIV infections. The reasons are multiple and complex, but one contributing factor is the use of unsterilized needles in settings such as tattoo parlors and during intravenous drug use. It's important to note that HIV transmission isn't limited to tattoo needles. It can also occur through sexual intercourse, especially unprotected sex. This is why safe sex practices are important, as is avoiding percutaneous injury through sharps like razors or needles used in piercings and tattoos. In conclusion, the potential for HIV transmission through tattooing needles is a real risk, albeit a small one. The best way to mitigate this risk is through awareness, education, and insisting on proper hygiene standards in tattoo parlors. After all, a tattoo might be a form of self-expression, but it's not worth risking your health over. So, the risks associated with tattoos aren't just skin deep. And what about traumatic tattoos and the risk of irreversible tattooing? Traumatic tattoos, unlike the usual decorative or symbolic ones, are permanent discolorations resulting from new skin growth over foreign material or dirt left behind in the dermis, the layer of skin beneath the surface. This can occur if a wound isn't properly cleaned and foreign materials are left behind. Now let's talk about suturing techniques. These are methods used to close wounds, and if done improperly, they can lead to traumatic tattooing. For instance, using skin adhesives like 2-octyl cyanoacrylate, often marketed as DermabondR, can lead to irreversible tattooing if not used correctly. These adhesives work well on small areas without much tension or shearing, but if they seep into the wound and aren't properly cleaned off, they can leave a permanent mark. So, remember, correct suturing techniques are vital to avoid the risk of traumatic tattoos. You might be surprised to learn that tattooing is sometimes used in medical procedures. Indeed, beyond the realm of personal expression and body art, tattooing has found its place in the medical world. One such instance is in the reconstruction of the areola, a delicate procedure often required after breast surgery. To create a realistic-looking areola, specialists use a technique that involves tattooing the area with pigment. This process helps to replicate the natural color and gives a more authentic appearance. Now you might be wondering, how is this done? Well, local and distant skin flaps are often used in these procedures. For instance, a local flap like the fishtail or skate flap is commonly employed. These flaps allow simultaneous nipple and areola reconstruction, bringing about a more complete and natural look. But that's not all. Tattooing can also be used in marking areas for surgery or radiation therapy. It's fascinating, isn't it? How a cultural practice such as tattooing can have such diverse health implications. Before we wrap up, we have a small request. Just as the art of tattooing requires precise strokes, our channel thrives on your precise support. Please subscribe now to join our community. Your subscription is the ink that colors our channel, enabling us to bring you more intriguing content like this. And if you found this video interesting or learned something new today, give us a thumbs up to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Just like the intricate designs of a tattoo, your likes and shares help to intricately design our channel's success. Thank you for your support. It's your continued patronage that allows us to delve deep into topics that intrigue, educate, and inspire. So, let's keep this journey going. One video, one tattoo, one medical marvel at a time. Moving on from our discussion about the fascinating world of tattoos, we want to tell you a little bit more about us here at Medicine Health 360. Our dedicated team is committed to bringing you the most recent and significant medical and health information. Our mission? To make complex medical information accessible to everyone. And why do we do this? We firmly believe that the better informed you are, the better decisions you can make about your health, leading to a healthier and happier life. You'll find a wide range of videos on our channel, exploring various health topics, from the intriguing to the essential. And as we close for today, we want to invite you to join us on this journey to better health. So, stay tuned because we have a lot more videos coming your way.